be accessed individually. We suggest you start by clicking your mouse on the button to the left. What causes GERD? We hope you find this presentation informative.
People that experience frequent, persistent heartburn 2 or more days a week, despite treatment and diet changes, could be suffering from gastroesophageal reflux disease, or GERD, a condition caused by acid reflux. Acid reflux is a condition in which the acids from your stomach move upward into the esophagus. It occurs when the muscles in the esophagus weaken. The symptom of reflux is called heartburn, that burning sensation you feel in your chest and throat when there is a backward movement of acid into the esophagus. In most people, symptoms are short-lived and occur infrequently. The condition, however, can become chronic, with the acid causing irritation, inflammation, and even erosion of the esophagus, a condition called erosive esophagitis. Symptoms can also occur without any signs of inflammation or injury to the esophagus.
The esophagus, commonly called the food pipe, is a narrow muscular tube that moves food into the stomach with wave-like contractions. Once in the stomach, the food is broken down and digested by acid. Unlike the lining of the stomach, which has a thin protective layer, the lining of the esophagus is not designed to protect against stomach acid. A structure that protects the esophagus from damage from the acid is the lower esophageal sphincter, or LES, which acts as a valve, keeping the food and acid inside the stomach. The valve opens after a person swallows in order to let food enter the stomach. It then immediately closes to prevent acid reflux. Pressure keeps the LES closed until food is swallowed again. If there is not enough pressure, acid reflux can occur and cause heartburn.
According to the National Digestive Diseases Information Clearinghouse, more than 60 million American adults experience GERD and heartburn at least once a month, and about 25 million adults suffer daily from heartburn. Other experts have noted the increasing prevalence of GERD and have estimated that as many as 20% of Americans experience symptoms associated with the disease. Acid production in the stomach may be stimulated by 3 receptor pathways: the acetylcholine, gastrin, and histamine receptor pathways. Acid production results when acetylcholine, gastrin, or histamine bind to their receptors on the parietal cells that line the stomach. There are currently 3 classes of drugs used to treat heartburn and GERD: antacids, which neutralize acid; histamine receptor blockers, or H2 blockers, which reduce acid production by blocking histamine; and proton pump inhibitors, or PPIs, which decrease the production of acid directly within the parietal cell. Patients with mild to moderate GERD can be treated by making lifestyle changes, such as eating small, regular meals, avoiding fatty, spicy, or acidic foods, limiting alcohol consumption, and exercising, and by taking antacids. Many antacids are available without a prescription and are frequently recommended to relieve short-term symptoms such as heartburn. The effects generally only last from 30 minutes up to 2 hours before symptoms return.
Antacids are available in liquid form or as chewable tablets and can be taken when symptoms occur. Antacids work by neutralizing the digestive acids in the esophagus and stomach. The acidity of the gastric fluid is reduced and is therefore less able to irritate the esophagus when acid reflux occurs. Acid production in the stomach is not inhibited by the presence of antacid, so although the antacids are fast-acting, they're not long-lasting. The symptoms of GERD, heartburn, and reflux may start up again after as little as 30 minutes.
The advantage of antacids is that they provide immediate relief by neutralizing acid in the esophagus and stomach. They are best used for relief of occasional and unpredictable episodes of heartburn. For persistent heartburn, the second line of defense for the millions of sufferers are histamine receptor blockers, or H2 blockers. Where antacids work by neutralizing acid immediately, H2 blockers work by reducing the body's acid production rate in the parietal cells in the lining of the stomach. This type of medication uses the patient's bloodstream to carry the medicine throughout their body, then reduces the amount of acid that is secreted into the stomach by preventing histamine from binding to its receptor on the parietal cells in the lining of the stomach.
H2 blockers are usually taken at night, before going to bed or before meals. Some people may need to take them twice a day or more frequently. Once taken, H2 blockers travel to the stomach and small intestine, where they're absorbed into the bloodstream. The medication travels through the blood to the acid-producing parietal cells in the stomach and slows down the production of acid by primarily blocking one of the three acid-producing pathways. Because the medication has to travel through the bloodstream before it starts to prevent acid production, it takes between 30 and 90 minutes for H2 blockers to work. However, H2 blockers have benefits that last longer than antacids.
H2 blockers reduce acid secretion and can be very useful for people who need continual relief. A reduced amount of acid is still produced due to the continued stimulation of the other two acid pathways. Some experts are concerned also that patients may build up a tolerance to H2 blockers, reducing their efficacy. H2 blockers provide partial suppression of acid production, but the relief is not immediate. Proton pump inhibitors, or PPIs, are the latest therapeutic advance in the treatment of GERD and heartburn symptoms. PPIs, like H2 blockers, also work to stop acid production. However, PPIs block acid production at the source, the acid-producing parietal cells of the stomach, regardless of the stimulus from gastrin, acetylcholine, or histamine. PPIs provide long-lasting control of acid production and are generally prescribed to be taken once a day.
Once PPIs are taken, they travel through the stomach and into the small intestine, where the delayed-release coating can dissolve and the medicine can be absorbed into the bloodstream. Once in the blood, the PPI travels to the acid-producing parietal cells in the stomach. These cells become active after a meal, but the PPI works to permanently deactivate the active acid-producing pumps. By directly blocking the action of these proton pumps, the medicine significantly reduces the amount of acid that causes discomfort and damage. Therefore, PPIs prevent the production of stomach acid more thoroughly than H2 blockers.
They may also reduce acid reflux that typically occurs during strenuous exercise and when sleeping. Despite their widespread use, currently marketed PPIs have limitations related to their delayed release profile and dosing requirements. Better control of heartburn related to GERD is still needed because up to half of patients taking PPIs still experience some breakthrough heartburn. No product is currently available that provides a combination of rapid and sustained 24-hour heartburn control on the first day. Another treatment option that combines the effects of an acid reducer with the fast relief of heartburn from antacids is an H2 blocker plus antacids. The H2 blocker partially blocks acid production by blocking histamine, one of the three pathways to acid production. The currently marketed H2 blocker plus antacid product is an over-the-counter medication which is typically taken once or twice a day.
An H2 blocker combined with antacids is taken in the form of a chewable tablet. The antacids neutralize the acid in the esophagus and stomach, resulting in relief of symptoms on contact. After reaching the stomach and small intestine, the H2 blockers take between 30 and 90 minutes to travel through the blood and affect the acid-producing cells in the lining of the stomach. H2 blockers slow down the production of acid by blocking one of the three acid-producing pathways.